Over the last 24 hours, we identified 422 new cases of COVID-19 and completed about 8,300 tests. That puts our positivity rate at about 5.1%. This is a significant decline from the peak of our rolling 7-day average positivity on September 27th, when it was 11.3%. This decline in community cases is mirrored in the number of cases in schools. Currently, there are active alerts or outbreaks in 211 schools. Of these, only 10 schools had 10 or more COVID cases who attended within the last 14 days while infectious. The number of people in hospital for COVID-19 also continues to decrease. Currently, there are 608 people being treated for COVID-19 in hospital, 128 of whom are in the ICU. While we are headed in the right direction, I want to be clear that this is still a significant number of people in hospital, taxing our healthcare system. We must all continue to support efforts to bring these numbers down even further. And sadly, despite our declining case numbers, Albertans continue to die from this virus. In the last 24 hours, 8 new deaths were reported to Alberta Health. Following a review, as per our usual process, 4 previously reported deaths have been reclassified as non-COVID. In addition to vaccines, we now have an additional tool to help prevent severe outcomes for those at the highest risk. Alberta Health Services has begun administering a new monoclonal antibody treatment for COVID-19 that was recently approved by Health Canada. Sotrovimab is a new drug that was developed specifically for treating patients with COVID-19 who have mild to moderate COVID-19 symptoms. It is the first treatment to be offered to outpatients in Alberta. For maximum effectiveness, it must be administered within 5 days from when the symptoms begin. But let me stress that sotrovimab is not a replacement for COVID-19 vaccines. Albertans are still strongly encouraged to be vaccinated against the virus, as vaccines are the most effective method to prevent the serious outcomes from the disease. Today, AHS's EMS mobile integrated health teams began administering sotrovimab to patients in their homes who are age 65 and older, are positive for COVID-19, unvaccinated, and who wish to have this treatment offered. Patients in Fort McMurray and surrounding areas will receive treatment in an AHS clinic. Some patients who have received a solid organ or stem cell transplant will also be eligible to receive this treatment regardless of their vaccination status. The treatment is being rolled out across the province in a phased approach, starting with those at the highest risk of severe outcomes like hospitalization. For more information on this program, please visit ahs.ca/COVID-opt. So the announcement that Health Canada has approved Pfizer vaccine for a 3rd dose is encouraging. We have been working with the National Advisory Committee and our own Alberta Advisory Committee as we've been watching data over the past several months to focus on those who are at highest risk of severe outcomes if they should have a breakthrough infection. And so we have been recommending the use of this vaccine in anticipation of this particular change, but also knowing that we believe that the risks of severe outcomes from breakthrough COVID infection in those high-risk populations outweighed any risks of waiting for this particular decision to be made now that this authorization has happened. It's encouraging, but it also doesn't change the need for that ongoing assessment of the epidemiology of the disease, who is most at risk from severe outcomes after breakthrough infection. And so we'll continue to work with the National Advisory Committee and our own Alberta Advisory Committee on Immunization regarding their recommendations with respect to boosters for the general population. We know from our data that vaccines continue to provide very strong protection against severe outcomes for the general population. And those groups that are currently eligible are those who may have an increased risk, which again is why they're now able to receive that 3rd dose. So I think there's no specific timeline with respect to decisions. Again, we continue to monitor the evidence and make recommendations based on best available evidence. So planning is in place to be able to have clinics and locations so that at the moment of a decision by Health Canada, if Health Canada approves, once it goes through the very strict regulatory process that is necessary to ensure that the appropriate steps have been taken to assess the evidence on pediatric vaccine, that if Health Canada makes that decision and licenses pediatric vaccine, that Albertans would have access to it in a quick way. But of course, it is critical that the process be followed because we take vaccine safety very seriously, especially for children. So it's really important to be able to give Health Canada the time it needs to go through the submission and go through all of the processes that they typically do to make sure that the vaccine can be assessed before a final decision is made. And then pending that decision, again, if they approve it, we will be ready to go to offer it to Albertans.